together, and it is when it works together correctly, it is really amazing, and it truly is a miracle that that we're able to function like we do. Genesis 1:26 and 27 says, God said, "Let us make man in our own image according to his likeness." So God created man in his own image. In the image of God, he created him, male and female. He created them. And then another verse that I chose, Psalm 139:13 and 14. It says, "For you formed my inward parts, you covered me in my mother's womb. For I am fearfully and wonderfully made. Marvelous are your works, and that my soul knows very well." So there's plenty of examples in the Bible as to how we are a created individual. But I can tell you, the more you know about the human body, the more you will realize that there has to be a designer behind all of it. So what I did, it was so nice of Jeannie to actually tell me. She says, "You can talk about whatever you want." So I thought, oh, that's great, I can talk about anything. So one of the first things I did is to show a few facts as to why I believe we're made by a creator. Number one, and by the way, there was 99 of them, so it'll take us about an hour to go through most. No, we will not. I didn't put all 99 of them up here. So the human brain can store more than 4 terabytes. Now, for those of you with the computer background, 1 terabyte is a lot. So 4 is times 4. 4 terabytes is quite a bit. The brain generates more impulses than all telephones of the world combined. That's each person, each one individual's brain can do that. And they were talking about the heart and what's good for the heart and so forth. The heart pumps more than 48 million gallons in a lifetime. 48 million gallons in a lifetime. 50,000 cells died and were replaced by the time this sentence was read. So right there, 50,000 cells had actually died off, and another 50,000 took their place. One that I like next is, because I'm a right-handed individual, right-handed people live on average 9 years longer than left-handed. That I'm not sure what the science is behind that, but I guess that's just a silly statistic, I guess. So for all those of you that are left-handed in here, you better just try to prove this statistic wrong and, and get along farther. There you go. We each have 60,000 miles of blood vessels in our body. How can you fathom that we have 60,000 miles of blood vessels? If you go around the circumference of the Earth at the equator, it's roughly, I don't know, 27,000 miles. That's 3 times the length of the Earth going around the circumference of the Earth at the equator. That's a lot of blood vessels. That really is a lot of blood vessels. We have about 700 active enzymes that create or that break down proteins and give us energy and so forth. And of course, you know, there were some interesting body facts that dealt with teeth, and so those are the best ones, my favorite ones. Teeth are the only part of the body that cannot heal themselves. So no matter what you do to try to heal your tooth, you will not heal your tooth. Regardless, it's not possible. The tooth cannot regenerate itself, which is good for me because it keeps me in business. During our lifetime, I don't know why this one was on here, but during our lifetime, a person will swallow 8 small spiders. So I'm not exactly sure why that made the list of 99 on here, but I don't know how many I've swallowed, but I hope it wasn't very many of them. The total weight of bacteria is 4.4 pounds. 99% of the calcium in the body is found in your teeth. More than 100 different viruses that can cause a cold. Skin is completely replaced about 1,000 times in your lifetime. People with blue eyes and red hair. Anytime I see a patient with blue eyes or red hair, my guard goes up because they are more sensitive to pain than anybody else. So anyway, that's just a known fact that's been researched quite a bit. 100,000 chemical reactions occur in your brain every second. So in 1 second, 100,000 chemical reactions occur in your brain. Strongest muscle in the body is the tongue, and I can attest to that. The strongest muscle in the body is the tongue. When I work in the mouth, many times the tongue gets in the way, and sometimes you try to overpower it and you cannot do it. It is a very strong muscle. Don't worry, we're almost through with the facts here. 14 billion cells are in the brain at birth. But the bad thing about brain cells, most of you would probably have heard, is they do not regenerate. Those are the cells you're born with at birth, and what you choose to do with them and how you choose to exercise them, what chemicals you put in your body will affect those, and they will not come back. So do the best you can with the 14 billion that you were given. 300 bones at birth, and then eventually when you become an adult, it ends up being about 206. The adult performs 23,000 inhalations and exhalations per day, so you breathe in and out 23,000 times per day. We have about 40,000 bacteria in the human mouth. That's kind of a scary thought too. We have about 2,000 taste buds in the mouth. This is one that I had no clue on. The human eye can distinguish 10 million different colors. Now, some of us may have a hard time discovering between blue and purple and green and stuff like that. The eye can distinguish between 10 million different colors. Another one, the heart pumps with enough blood pressure, or enough pressure to raise the blood to a 4-story building. So, you know, there's water pumps and stuff like that that pump water to buildings, to high-rises. The heart does a pretty good job of it too. So, one fact that I've often shared with patients, especially if they become grumpy, and that is that you use 17 miles to smile and you use about 43 miles to frown. So if you frown, you're actually working out more than you are by smiling. So it's much better to smile than it is to frown. You're not going to wear out your muscles as much. We speak on average about 4,800 words per day. Another interesting fact is that the eyes never grow. They're the same size at birth as they are when you're an adult. But unfortunately the ears and the nose do keep growing, so that's not a very good statistic, I guess. But bones are 5 times stronger than steel. I think there was another one that I read that your femur, which is the long bone in your leg, is actually stronger than concrete. So bones are very strong. And then the final fact there, only 1 in 2 billion of us will reach to 116 years old. So if you make it to 116, you're 1 out of 2 billion that can do that. So anyway. Well, tonight I'm going to talk about the importance of dentistry and how it relates to the human body. Almost everybody probably at one time in their life or another has heard about cavities and taking care of your gums and brush your teeth and so forth, but not everybody probably knows why, or maybe the science behind it. So I want to go into a little bit of that tonight. First of all, dental caries. Caries is a fancy term that we use in dentistry. That's a cavity, basically. So it's decay. It's one of the most common infectious diseases affecting about 2.3 billion people. That's about 32% of the population. So people talk about heart disease, people talk about all these other diseases, when in fact dental caries is probably the #1 infectious disease that affects the most people as far as the overall number. More common in the developed world, and that is because of something called sugar. More people eat sugar in the developed world, therefore more of us get cavities in the developed world. The next disease we're going to talk about is periodontal disease, is what we call it's gum disease. It affects about 750 million people, which is about 11% of the population. And the other well-known fact is that the mouth is the gateway to the rest of the body. What you put in the mouth, what goes in the body goes through the mouth, and the mouth is the gatekeeper. It's what keeps us healthy, or the opposite too. So with dental caries or cavities, there needs to be 4 things that have to occur, and you have to have them for you to have dental caries. If you take one of each of these 4 out, you will not have cavities. Okay? So the number 1, my mic still like this. Number 1, you have to have a carbohydrate substrate, which is basically a sugar of some sort. You have to have sugar. You have to have bacteria. You have to have a tooth. And you have to have microorganisms. You have to have bacteria. You have to have all 4 of those. And when you have all 4 of those, then that is what causes decay. So you can have as much sugar as you want. You can have as much bacteria as you want. You can have as many teeth as you want. And you can have enough carbohydrates as you want, but if you do not have all 4 of them, you will not get decay. And that's why in the middle here, where number 5 is right here, I know it's kind of small, but that's the only area where you actually will get decay. If you take any one of those out, if you take the teeth out, you won't get decay. If you take the bacteria out, you won't get decay. Very difficult though, because when you have 40,000 bacteria in your mouth, it's difficult to take some of those away. But anyway, it just goes to show that you have to have all 4 of those to be able to get cavities. So I always try, it seems like people when they're in the health field, they always try to find the grossest, ugliest pictures, it seems like. So these are definitely some examples of dental caries up in this area here, and then some even worse cases here. So anyway, just a few pictures of what cavities look like. The treatment of dental caries. Number 1, the most common treatment of dental caries are fillings or crowns. Number 2, sometimes root canal treatments. That is when you get decay that gets into the nerve and the nerve dies, then you need to have a root canal. If it's not fixable, then of course it will lead to an extraction. And then some of the alternatives, implants, partials, dentures, or a combination of implants and dentures. That's what you can have when it comes time to replacing what you have lost. So that's quickly through dental caries. Periodontitis is kind of what we're going to talk about the rest of the night. Dental caries really, for the most part, doesn't affect the overall health of the rest of the body or lead to other diseases as much as periodontitis. Periodontitis is the infection of the gum. People will say gum disease. People will call it pyorrhea of the mouth. There's all kinds of names for it. What it is basically is you have an inflammatory disease that affects the tissues surrounding the gum, such as surrounding the teeth, such as the gum and the ligaments that hold the teeth in place and bone. So that's basically what we call the periodontia. And so that's what holds the teeth in place. So periodontitis, anytime you see itis, it's an inflammation of the gums and so forth. It is caused by microorganisms that grow on the tooth surface, and it can also be caused by an overaggressive immune response. And that is a very, very important, the last one there, the overly aggressive immune response is very important because that's what leads to most of the damage with other diseases and so forth. So some of the symptoms of periodontitis, redness or bleeding gums, you can have swelling of the gums, you can have bleeding when you brush, you can have bad breath, we call that halitosis, gingival recession, lengthening of the teeth, deep pockets, and then finally loose teeth that become loose and want to come out. The sad thing about periodontitis is most symptoms are painless. Most people do not really know that they have it, other than the fact that, you know, maybe the teeth finally get loose and they want to fall out and so forth. So the causes of the periodontitis. Number 1, it would be, well, I shouldn't say number 1. These are all causes, not necessarily in order, but some of them are more serious than others or more causative than others. Number 1, ineffective oral hygiene contributes to the plaque accumulation. The longer you have the plaque that stays on the teeth, the more destruction you're going to have. Smoking is a really big one with periodontitis. Probably, it's like it says here, the most important risk factor. It causes decreased wound healing and suppresses the antibody production. So the antibodies are what your body produces, your immune system produces it to help fight off bad bugs, if you would. The microbial plaques calcify to form calculus or tartar. This is the stuff that grows and attaches to the teeth and so forth. Genetics is a huge one with periodontitis, such as Down syndrome, diabetes. There's other things. When I say diabetes, more towards type 1 diabetes, the kind with insulin dependency, and bacteria and microbes. When it comes to talking about bacteria in the mouth, when you have cavities, there's a certain type of bacteria that causes cavities, but there's also a certain type of bacteria that causes periodontal disease. And it's important to know that there are actually 2 different types of bacteria. When I say 2 different, there's many more than that. But there's bacteria that causes decay, there's other bacteria that causes bone problems. So it's kind of rare to see both of them together. Most of the time, you will have one or the other in a lot of patients, unfortunately. So the periodontitis mechanism, and again, I'm trying to keep this as simple as I can because I don't like to talk about people. I want to try to keep it so that you understand it. So I'll do my best to continue to do that. And if you have a question, you can let me know. The plaque accumulates in the pockets around the teeth, which causes a change in the microflora or causes a change in the bacteria that's in the pockets. We have something that we call gram-negative bacteria. Gram-negative bacteria are very harmful to our teeth, especially. Number one is a very long name, and most people probably can recite that by memory. Everybody knows it's Actinobacillus actinomycetocomitans, or fortunately when you go through school they just call it AA, which is a good thing, and everybody knows about it. So the other one is very destructive, is called Porphyromonas gingivalis, they call that PG, and then the last one is Bacteroides forsythus. Damage to the teeth and the gums comes from the immune system, which tries to get rid of the microbes. Cells take up the antigens from the microbes that are in your body and they present them to the immune system, and then the white blood cells come in and take over and hopefully fight it off. In cases where you have the periodontitis that gets too severe, it's you're becoming overwhelmed by your immune system. Your immune system cannot take care of it. So then what eventually happens is we have something called osteoclasts. Osteoclasts are a cell in our body which actually breaks down bone. And so osteoclasts are very useful in dentistry. If we could not have osteoclasts, we would never be able to have orthodontics. Orthodontics, when you move teeth through bone, how do you physically move a tooth through bone? Well, the body is very miraculous in the sense that it actually produces osteoclasts which eat the bone away, and then the tooth moves through the bone, and then osteoblasts lay down bone. So anyway, osteoclasts are activated because of the immune system. They're activated, which causes bone destructions, and then we have something called MMPs, which cause ligament destruction. MMPs are matrix metalloproteinases. They're enzymes that help cause tissue destruction, is what they are. So they get in and they cause damage to the ligaments, which hold the bone in place, which is the core structure of the teeth and the bone. So in summary, bacteria initiates the disease, which causes an exaggerated response from the body's immune system, which causes the key destructive events. So without bacteria, again, without bacteria similar to caries, we don't have periodontitis. So that's kind of the name of the game, is reducing or trying to get rid of bacteria. So how do we prevent, yes, Pastor Vincent?
Yeah. Question, to get rid of all this 40,000 bacteria, what about these various mouthwashes?
Mouthwashes are very
like
good.
Listerine and some of those other things?
Listerine is very good at killing bacteria. The problem is bacteria reproduce about every 20 minutes. So if you really want Listerine to be effective, you better use it every 20 minutes. I'm not a big mouthwash person. The problem with most mouthwashes too is they're good at killing bacteria. The problem is the bacteria that you're trying to kill is below the gum. It's below the gum, and the mouthwashes cannot get below the gum. So if it makes you feel better because it makes your mouth feel fresh and so forth, by all means, use the Listerine. But don't use it because you think you're killing bacteria. Yes, you're killing bacteria, but 20 minutes later you're going to have just as many as you just had. So
we can save money.
That is true, yeah. Yeah. I hope nobody in here is working for a company that sells mouthwashes, because then they're going to come chastise me at the end here. So prevention of the periodontitis, how do you prevent it? Number one, regular checkups is the most important. More frequent cleanings, 3 to 4 times per year. Meticulous oral home health care, because the home health care, the daily removal of some of the plaque, is where you're going to get most of the change. That's where you're going to get most of the prevention. And also controlling other diseases, which we'll get into in a moment, such as diabetes, etc. Most of the bacteria that's found below the gum level, which is the one that affects periodontitis especially, most of that bacteria really starts to get out of hand at about 3 months. And so that's why with people who go through periodontal treatment, they tend to get their teeth cleaned more often, because when you go in there about every 3 to 4 months, you get in there mechanically. When I say you, I mean myself or a hygienist goes in and mechanically disrupts the bacteria and removes the plaque that's underneath the gum. So that's why for most people that are in a periodontal case, every 3 to 4 months is the importance of getting the teeth cleaned. So, you have a question?
My son has a health condition that he requires to take Dilantin, and this causes swelling of his gums, and he gets a year. I pay for that periodontal cleaning, spatial extra cleaning. Is that basically the right?
Yes, the good thing with Dilantin is it is more of a gum problem, so to speak, where the gum swells. You don't necessarily get the problem where the bone disappears. So yes, it's the same idea though.
It controls his seizures.
Yes, it is very important to continue to take Dilantin for those cases. But unfortunately with most drugs, there's always side effects.
Yeah.
And the #1 side effect of Dilantin is the gums grow, actually. So.
They actually say it also causes liver disease, so you know, okay.
Yeah. Alrighty. So just to go over a little bit of history of periodontitis. It's obviously been around for many, many years, probably since man was walking the face of the earth. In the 19th and the 20th centuries, the theory of focal infections was prominent. In other words, they believed that other things would cause it. They thought it was related to other diseases such as arthritis or ulcers or even appendicitis. And so what would they do for it? There was therapeutic edentulation was the preferred treatment. In other words, they take out all your teeth. So that's why back in the 18th, 19th centuries, you know, times of George Washington, everybody knows George Washington had dentures and so forth. Well, he did have dentures, and it was because probably he suffered from something similar to this. Fortunately, that theory has been discredited years later because otherwise nobody would have teeth anymore, hardly. Now it's become clear that the oral cavity has become the origin for pathogens or you know, disease-causing bacteria to move to other body sites by way of the bloodstream, especially when you're immunocompromised. Immunocompromised means your immune system is not working properly. Diabetes is a perfect example of being immunocompromised. So bacteria love teeth, as we said earlier, especially with caries, with dental cavities. Remember, they're the only non-shedding tissue or the surface in the body. Periodontal infections are associated with complex microfloras. So the microflora is a community of bacteria that lives in a certain place. And so periodontal infections, when you get an infection, it's because you have a community of bacteria together that start doing tissue destruction. There's approximately 200 species of different bacteria responsible for apical periodontitis. In other words, apical periodontitis is as far up as the root as you can go. And another 500 with marginal periodontitis. So there's 700 different types of bacteria that are responsible for periodontitis. So it's impossible to control all of them, in other words. Most of them are the gram-negative rods. Remember we talked about the AA and the PG ones.
Excuse me.
Yes.
If somebody gets a bone graft for implant, it takes long process to fix the implant. At that time, is any disease or bacteria goes in the bone graft or make a problem or not?
It definitely can. The big problem, I shouldn't say a big problem. The #1 problem for loss of an implant is called Peri-Implantitis, and it is due to bacteria that gets in to where the implant is. How often does it happen? I don't know the actual percentage of that, but it's not very high. Most implants, the survival rate of an implant is about 95%, which is very good. So about 5% of the time the implants can fail, and more than likely most of them will fail due to bacteria. So does that kind of answer your question?
Oh, yeah, but sometimes make something after a few months, like white blood cells goes down, something like that, or not? Is it symptom of the bone graft or not?
Okay, so when you have a bone graft, what happens is the practitioner, the dentist, will put bone graft. It's actually a cellular matrix that goes in there, and that whole bone graft is actually replaced by your own bone. And so that's the beauty of a bone graft, is it's basically, it's kind of jump-starting your body to produce its own bone and to hold the shape of the bone so that your bone can then fill in there. So the chance of it failing is usually not very high, and if it fails, there probably is a pretty good chance it's due to bacteria that gets in there. So, but it's not very high. That's a good thing. So just one more time to hit on this last one here, the anatomical closeness of the bacteria that's in the bloodstream facilitates bacteremia, which is an infection in the blood, and the systemic spread of bacterial products. We're kind of going to come back to that in a little bit too. So the systemic diseases caused by oral infections. Now recognize that the oral infections, especially periodontitis, may affect the course and pathogenesis of a number of systemic diseases, such as cardiovascular disease, bacterial pneumonia, diabetes mellitus, low birth weight, and I put breast cancer on here too. Breast cancer, there's some newer research that's coming out with the cause of it. That one is still kind of in its, a little bit more in its infancy. There is definitely some research that shows that it may be a causative effect toward breast cancer, but again, that research is a little, it's lacking a little bit, but it is still definitely important. So bacteremia, this is the presence of bacteria in the blood. In the mouth, when I work in the mouth, for instance, and we need to take a tooth out, when I take a tooth out, you obviously get bleeding. It's an open bleeding into the mouth, and you have bacteria in the mouth that crawl into the bloodstream. That can cause a bacteremia. That happens virtually 100% of the time. The good thing is, with most of us that have a decent immune system, is it doesn't bother us, which is a good thing. In some cases, with patients that have diabetes that's uncontrolled, for instance, then all of a sudden this can be a real big problem because your immune system cannot fight off the bacteria. In some of those cases, what we would do, if there's a case where we anticipate bleeding, we'll actually give you some antibiotics, usually about an hour before the procedure, so that it loads your bloodstream up with antibiotics to help kill off the bacteria as it's introduced into the body. It's also common with scaling and wisdom teeth extractions. Scaling is another word for like deep cleanings and so forth. Root planing, we call that. That's scaling. And root canal treatment. So bacteremia is something that's always happening. It's something that we take for granted that our immune systems work well and they fight it off very good for the most part. Bacteremias can occur as quickly as 1 minute after a procedure. So as soon as the bacteria gets into the bloodstream, it's moving throughout parts of the body. Organisms move into the bloodstream and travel to the heart, to the lungs, to everywhere else. It's very important in patients with heart valve replacements, total joint replacements, and patients that previously have had endocarditis. Endocarditis is infection of the lining around the heart. If you've had any of those type of things, especially heart valve replacements, total knee replacements, and so forth, we usually always will give you some antibiotics before a dental procedure that causes bleeding. And the reason why is, again, we want to make sure that the bacteria that's in the blood, that's introduced into the blood, we want to make sure that there's some antibiotic in your bloodstream to help fight that off. The last thing I want is to have a orthopedic surgeon call me and say, why in the world did my patient who has a total knee replacement have an infection in their knee? They're not going to be too happy with me on that. So, and then, again, with the bacteremia, if you have a normal oral hygiene and you're very good about keeping your teeth clean, not usually a very, very big deal. It's a very low risk. If you have poor oral hygiene, then you become a higher risk, and so forth. So cardiovascular disease. One of the cardiovascular disease, heart disease, the #1 killer, I believe, among the people here in the United States. So it's a very, very serious one. We have some shared risk factors with the periodontal disease, such as tobacco, such as stress, which nobody ever has anywhere, right? Stress. Aging, race, and or ethnicity, or male gender. For some of us that are males, we have even more risk for cardiovascular disease. Atherosclerosis, or hardening of the arteries, is one, and the myocardial infarction, which is your ASIC heart attack, which are caused by some of the oral bacteria, which can induce platelet aggregation. Platelets are the things that run in your body that run to the site where you have damage. In other words, if you have a cut on your finger, you have platelets that go to your finger and will help stop the bleeding. And it's pretty amazing. That in itself could be a whole lecture in itself. How does blood clot? There's about 50 different cascades. There's about a 50 different step. If any one of those steps are not working properly, you don't have blood that clots. So anyway, the platelets get into the different areas, and it leads to a thrombus formation, or a blood clot. You hear the word embolism a lot of times. Embolism is a blood clot that moves through the body. A thrombus stays still, it becomes an embolism, or it moves once it breaks free of the vessel inside there. So that's why embolism can be very serious. They lodge in your heart many times, in your lung many times. Not good when that happens. So sometimes they get up into the brain and cause stroke. Periodontitis stimulates the liver to produce C-reactive proteins, which is referred to that as CRPs, which is a marker for inflammation, which form deposit in injured blood vessels. CRPs predict the risk for future myocardial infarction or stroke. There is actually a test that can be done with doctors, and they can determine your risk for stroke and so forth based on the CRP level. That's the level of inflammation that's found within your body. Continuing with cardiovascular disease, patients with periodontal disease have higher levels of CRPs. That's the inflammation again. Dental caries also causes tooth loss. People's eating habits change because when the teeth are missing, it's harder to chew more nutritious foods. When people are missing teeth, how many people do you see that are chewing carrots? How many people do you see that are chewing the things that are healthy for us to be eating? So it's very important, obviously, that we take care of the teeth, because the teeth help us create nutrients for our body that are healthy and so forth. So then what ends up happening is people will turn to eating a high calorie and high fat foods, which has an adverse effect of the absorption of the nutrients within your body. And then they become predisposed to cardiovascular disease also. So going on to the coronary heart disease, this is more the atherosclerosis, or again, the hardening of the arteries due to the plaques that are built up. It's a progressive disease that involves medium to large arteries. We have these little plaques that are found in the vessels that lead to the thrombosis. Remember, the blood clot, the thrombosis, which is associated with platelet aggregation, and then includes the arteries. It closes the arteries off. 50% of the deaths in the U.S. may be attributed to atherosclerosis and cardiovascular disease. 50%, 1 in 2 people usually will die because of cardiovascular disease or coronary heart disease. But the amazing thing about it, and the scary thing about it, is the bacteria that's found in those plaques have 2 of the most common type of bacteria that are found within periodontitis. Remember the AA and the PG, the 2 bacteria. Those are some that are very, very highly correlated with the thrombosis or the plaques in arteries. So there's a huge correlation between periodontitis and coronary heart disease.
Question.
Yes?
Is periodontitis also causing pulmonary embolism too?
Well, it's not. It could. A pulmonary embolism is just an embolism that starts somewhere else usually, and it lodges in the lungs. And so that embolism, like I was kind of going over there a little bit, starts somewhere, and it starts by having these plaques and so forth that are in your body. And so it definitely can. Now, where it goes, you know, a pulmonary embolism is an embolism that goes into the lung, and it's also one of the most deadly ones a lot of times too. So, so it can. So the blood vessels that, with a stroke now, up in the brain, blood vessels that carry the blood and the oxygen to the brain can get thrombus formation. In other words, a blood clot up in the brain. Poor oral hygiene was more common in patients with cerebral infarctions. So when parts of the brain die because of stroke, there's a correlation a lot of times between poor oral hygiene too. So when you have periodontitis, you're also at an increased risk of stroke. Infective endocarditis. This is again where the blood vessel lining, not the blood vessel lining, the lining of the heart is the endocardium. This is an infection that gets into the heart area. Bacterial infection of the heart valves or in the endothelium of the heart. It is rare, but in people with pre-existing conditions, bacteremia is more likely to occur. Again, the autoimmune problems, when you have many different autoimmune issues or when you have diabetes, you can have those same issues there. Bacterial pneumonia. Pneumonia is an infection of the pulmonary parenchyma, which is the lining around the lungs, caused by a wide variety of infectious agents. Microorganisms can infect the lower respiratory tract. They're most commonly caused by aspiration or caused by swallowing and so forth, breathing in of the oropharyngeal flora into the lower respiratory tract. And once again, remember these bacteria that I keep talking about, AA, PG, and the fusobacterium. They can find these bacterium in different parts of the body. And so it's important to try to keep these bacteria levels down in patients, especially that have periodontitis. Another one is low birth weight. Changes in hormone levels. I don't know if any of you guys know, but when a pregnant woman goes through pregnancy, they have changes in hormone levels. See, some people concur. I am trying to be careful. So anyway, there's changes in hormone levels during pregnancy which promote inflammation, or something we call pregnancy gingivitis. We don't really know as to why it happens other than it changes levels of hormones in the body. And you can get, usually with pregnancy gingivitis, the nice thing about that is it's not usually, it usually reverses after you have your child. And the good thing is it's not really damaging. It will cause the gums to swell and the gums to bleed and so forth, but it doesn't have long-term lasting events, unless you keep getting pregnant, I guess. Maybe then you would. It may occur without changes in the plaque levels, and the oral infections increase the risk to low-term birth rate also too. Problems with low birth weight include neurodevelopment disturbances, respiratory problems, congenital anomalies, and behavior anomalies such as ADHD even too. So low birth weight is another big cause with periodontitis. Risk factors include old and young maternal ages. I believe it was under 17 for the maternal age and over 37, I think it was, somewhere around there. The risk goes up for low-term birth rate. Unfortunately, it does follow into some races too, such as African American race, low socioeconomic status, poor prenatal care, drug and alcohol abuse, smoking, hypertension, or high blood pressure and so forth. Genital urinary tract infections, diabetes, and multiple pregnancies. So those all affect low birth weight also too. Risk factors. Evidence strongly supports an association between preterm or low birth weight and infection during the pregnancy. What this also suggests that distant sites of the infection may be targeting the placental membranes. So what happens in the mom can go over into the baby via the placental membrane and so forth too. There's something called TNF alpha, which is called tumor necrosis factor alpha. It rises steadily until the threshold for labor is met, and then once that is met, then all of a sudden you go into labor. It's a hormone basically is what TNF alpha is. During pregnancy, the ratio of the anaerobic gram-negative bacteria, which were those long names that we read earlier, the ratio of the gram-negative bacteria to the aerobic ones, so the anaerobic to the aerobic without oxygen, aerobic with oxygen, it actually increases in the dental plaque, which will then possibly escape into the bloodstream, which then crosses the placental membrane and then induces labor. So in cases where we have preterm births, there's usually a high correlation a lot of times between how well they're taking care of their teeth and what's going on in their mouth. Diabetes mellitus. I don't know if anybody's ever heard of diabetes, but unfortunately it affects many people nowadays. It does target some races. A lot of Hispanic races have a high increase now for diabetes and so forth. Diabetes, if you don't know, it is defined as hyperglycemia, hyper meaning too much. So hyperglycemia is high blood sugar, and it's due to an absolute or relative deficiency of the insulin. Insulin is produced in the pancreas, by the way. It affects more than 12 million people in the United States, probably even a lot more than that, because many of those 12 million people are the only ones that are even diagnosed. There's even more that are undiagnosed, so it's actually probably much higher than that. Type 1 diabetes is usually what they used to call a lot of times juvenile onset. That's when you're born with it, so to speak. Very dependent upon insulin. What's happening is the cells that are within your pancreas do not actually produce the insulin anymore. So when you don't produce the insulin, then you have to give yourself insulin injections. And that's found in the pancreas. Type 2 diabetes, which is the non-insulin dependent, what happens in type 2 is the resistance of the target tissues to the insulin. So in type 2 diabetes, you still have the insulin, but what happens is the tissues where the sugar is going to, they don't work as good with the sugar and so forth. So that's why, and I did hear Jeannie talk a little bit earlier tonight, she was talking about diabetes and she said type 2 diabetes. Type 2 diabetes is the one where you have a better chance of reversing. Type 1 diabetes, it's almost, from what I know about it, it's almost end of story. If you have type 1 diabetes, you're not going to reverse it. You may make it better by what you eat and so forth. It means you don't have to give yourself maybe as much insulin and so forth, but you're not going to reverse type 1 diabetes because you cannot get, for the most part, you cannot get your pancreas to continue to produce the insulin. So type 2 diabetes, big difference. You can make a big difference. I do remember Dr. Teskey, he gave a lecture once here in the room that I was at, diabetes, and he talked about the tissues have receptors in them, and those receptors, they have little gates in them, and the gates will open and let the sugar come into the different tissues for energy and so forth, and for the tissues to use their metabolic processes, if you would. And so what happens is that when you exercise, these little gates open, and the sugar that's going through the blood, that's circulating through the blood, will then go through these little gates and go into the tissues. And as he said, well, I'll never forget what he said. He says, walk, 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 walk. And what he meant by that was, the more exercise you give yourself, the more these gates open, which will also decrease your blood sugar and so forth. So there's a big difference with type 2 diabetes and so forth. The other diseases that I've talked about so far, other than diabetes, most of them, there's not a correlation, or it's not a two-way street, if you would. In other words, does coronary heart disease cause periodontitis? Probably not. Does periodontitis cause coronary heart disease? That's where more of the relation is, because of the bacteria levels and so forth. Preterm birth weight, low-term birth weight, you know, if you're pregnant and you have a low-term birth weight, obviously, yes, you're pregnant, you can't have it without being pregnant, but it's not causing the periodontitis. It's the periodontitis that's causing the other disease. Diabetes is the one where there's a two-way street on. There's a big correlation, a high correlation that's been proven time and time again, that if you have diabetes, it can cause periodontitis, and periodontitis definitely can cause diabetes and make it worse. Each one can make each other worse, in other words. So that's a very, very big point to distinguish between diabetes and periodontitis as opposed to the other diseases. And of course, with diabetes, it's a combination of environmental factors and genetic susceptibility. Type 1 diabetes, you're born with it. Usually it's genetic that causes it. It can still be genetic when it goes to type 2, but not as much. It's more environmental a lot of times. What you eat and what you're surrounded with type 2 for the most part.
Dr. Rusk, they're finding more and more that the dairy in children is causing the beta cells to be destroyed by the dairy, and so they're having a late.
Yeah, thank you. Yeah, I was not aware of that. Thank you. So severe periodontal disease. So when the periodontal disease gets bad enough, it often coexists with severe diabetics, or diabetes also. Diabetes is a risk factor for periodontal disease, and the converse is gaining more ground. So in other words, again, it's a two-way street. One causes the other causes it back, in other words. So there's so much information on diabetes and periodontal disease, it can be a whole lecture in itself too. There's a combination of two different pathways, infection and advanced glycation end products. There's a lot of big words in here, I realize that. What it is basically your immune system. That's what a lot of it is. You have mediated cytokine, what they call cytokine upregulation. It helps to explain the increase in the tissue destruction seen in diabetic periodontitis, and how the periodontal infection may complicate the severity of the diabetes and the degree of the metabolic control results in a two-way relationship. So I put that slide in there for those of you that like immunology a lot. It goes through a lot of the nitty-gritty as to why you get tissue destruction and so forth. Periodontal infection may induce a chronic state of insulin resistance, which obviously is the crux of diabetes. It contributes to the hyperglycemia, which again, too much blood sugar, and it leads to diabetic connective tissue degradation, destruction, and proliferation. Therefore, the relationship between diabetes and periodontal disease becomes two-way, which results in more severe periodontal disease and increased difficulty in controlling blood sugar. If a patient comes into my office and they tell me they have diabetes, one of the first things I ask them is, what is your blood sugar level and when did you last take it? If they tell me that it was, 125 and they took it 3 weeks ago, I say you better check it again, because, if they're, I will ask them different questions to try to elicit from them how severe of a diabetic are they. Are they taking one medication? Are they taking 3 medications? Are they taking 2 different types of insulin and stuff? Those are all very serious questions for me, because I want to know what is the healing capacity, or what is the capability that that patient is going to heal when I will go in and surgically do something, for instance. If your blood sugar is regular and you're able to control your blood sugar, I don't treat you any different than I would any other patient. If the blood sugar starts getting out of control, then many times I'll start to say to the patients, you know what, you might want to go back and see your doctor and get this under control, because what I need to do is going to be a detriment to you. I'm actually going to make things worse by introducing a surgical procedure, for instance. That's the last thing I want, is that patient to all of a sudden not be able to heal. And I rely on a patient's healing ability, especially. So, I thought it just stopped, huh? Hello? 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 Does that mean I'm done? Where's that other microphone? I can use that other microphone too.
Where's the handheld mic?
Do you push the mute button or the select button?
The one on the right that's got the power.
It's, yeah, the select one.
Should have a green light.
Okay, can you hear me now?
Yeah.
We're getting close to being done here, so anyway. So with diabetes, findings suggest that the severe peril may be an important risk factor in the progression of diabetes, and the control of the periodontal infection is essential to achieve long-term control of diabetes mellitus. Breast cancer, this is our last topic here. Researchers have found that women with gum disease had a 14% overall increased risk for breast cancer over women without gum disease. If they smoked, that percentage goes up to 30%. More research is needed in this area to study the connection between the two. It is clear, however, that gum disease does not help the situation. So, again, gum disease is basically knocking out the immune system of the patient. If we have a good immune system, we don't worry about hardly any of these things, because the chance of something happening is very, very slim, and so forth. So, okay, so that's all I have. I do have a little video too, but I'll take some questions in a second. I have a little video that's kind of a funny little skit, sort of. If I should have had you load that up earlier there.
When you first said about giving you our email so you could send us this, how do we do that? Just give them a piece of paper with it?
Yeah, if you want to give them to Jeannie maybe, and then she can give them to me, or and maybe she can forward them to me.
I have a question.
Uh-huh.
Have you heard of silver amalgam treatment on children as well as adults?
Silver amalgam treatment, as far as using silver amalgam on kids and so forth? Yes.
It was a PBS blitz, and the Indian tribes were bringing all their kids. Some of the moms had 5 or more kids. And when they got the silver amalgam, the cavities didn't come back. It does turn your teeth black for a while, but then they said they whiten the teeth later in this treatment, and the treatment's very economical. So all these Indian ladies didn't want regular treatment anymore, they wanted the silver amalgam.
Yeah,
I've asked a couple of dentists, they've never heard of it.
I think what that's called, it's not the silver amalgam. From what I think, it's actually I think it's what they call diamine silver, I think is what it is. And there is some research that's showing that is helpful, I guess you could say. The big thing is it causes black staining. I don't really have, I've never really studied up on that. It's kind of coming new down the pipe, if you would. So, I mean, there's probably hopefully some credible research that's showing that. I wouldn't use it yet until there's more research that shows whether it's actually good or not. So,
Is there anything that would show why teeth would begin to darken without any kind of, like I had that when I was young, my teeth just would get dark, they just got dark.
teeth start to
Not
darken.
real dark, but just.
Teeth start to darken. The question was about darkening of teeth. Teeth start to darken because what happens is the inside part of the tooth actually starts producing cells that lay down in the nerve area, the pulp area of the tooth. And as those nerves as the cells lay down with what we call dentin, the inner part of the tooth, what happens is the tooth starts to darken over time. So unfortunately, that's kind of inevitable.
And it has
As we
a
age,
connection
teeth start to
to
dark.
Periodontal
Was this
disease.
done on an Apple Macintosh?
I don't remember. Oh, yes.
Yeah, this one here's not.
It's not in play.
No, it'll play it on here, but it'll play it on.
Can you do you have access to the internet on this one?
No, not
Okay.
here.
Okay, well, we won't be able to do that. Okay, that's okay. So
Sorry.
we can see it on there. Oh, if you can do it,
If it'll adapt or not.
I can catch it on YouTube too. It's on YouTube, so you can,
Oh,
if she has a
oh,
spot on
I
there.
see what you're saying.
Yeah, Keith.
I have one question, but one comment first. My mom was in a lot of pain. When she was in that pain, she had diabetes, which the pain went away because we had the plate taken out of her leg. Her diabetes went away.
When you have what taken out of the leg?
Plate.
Oh,
Plate.
gotcha.
She had broke her hip. And it got loose again and caused a lot of pain. But my question is, osteoporosis in the jaw, if the dentists are always very concerned if you take Fosamax or Nevo, what is the reason for that?
The reason for that is something called ONJ. It's called osteonecrosis of the jaw. And it's one of those things where you don't see it very often, and when you see it, it's ugly. I have one case right now of a patient that I have that has it, and literally you just, it's mostly a lot of times in people that are going through chemo, a lot of times too, but who take the Fosamax and so forth. So what ends up happening is their immune system again becomes compromised, and you will actually get the gum that just strips off of the bone. And so this guy comes in here a couple weeks, about 3 or 4 weeks ago, and I've been treating him for a while, and all of a sudden he has a tooth that's loose. Within 2 weeks, the tooth just falls out. And it's a very serious problem, but the reason why they're taking those medicines is because of the bone issues and osteoporosis. So if you have osteoporosis, then they're wanting you to take those medications. But what happens is in those cases, especially where it's an IV case as opposed to an oral case, IV cases, they get usually a shot about once every 3 months a lot of times, and those are the serious cases where we get the necrosis. And I mean, you'll see ulcers in the mouth, and all of a sudden the tissue just sloughs away, and you can see the bone, and it's very difficult to control.
Is Prolia better?
Is what?
Prolia?
Prolio?
Prolia.
Prolia, I'm not familiar with that.
Instead of killing the osteoclasts, it stimulates the osteoclasts.
I don't know, to be honest with you on that one. Yeah, go ahead.
If we try to wash our teeth with the baking soda, is it bad or is it
No.
okay?
No, that's okay.
Because it's not as bad as the other mouthwash the doctor gave me because I had an infection. She prescribed the chlorodretrin, something like that. I forgot the name.
Chlorhexidine, probably?
Yes.
Chlorhexidine.
That makes my teeth black.
Yes, it stains. It does really good, but it stains. You can't find the...
I can't get it to get the,
Oh, we won't go on that screen.
no, it's showing the other screen, showing the desktop.
Yes, go ahead.
What do you think about the implants, the ones they're showing now, where screw them in there?
What do I think about them?
Yeah, do you think that's?
If you have to miss a tooth, or if you have to get a tooth extracted, an implant is the next best option about restoring or replacing missing teeth. Very acceptable to the body. The rejection rate is probably less than 5%. So implants are very nice. The number one drawback of implants are the cost. Implants are not cheap, but it's a very good option.
And, do you know the procedure? Is it, how do they get that screw in there? Is it like a partial that goes in, or is it?
How much do you want to know? How much detail do you want to know?
I don't know.
So what you do first is usually you're doing it where, yeah, with a hammer and chisel, yeah. Most of the time when you have where the tooth used to be, we call it the ridge, or the alveolar bone, you're going to have the gum that goes over the top of it. You're going to make an incision in the gum. You just move the gum away a little bit. You get to where the bone is, and you basically use a series of drills, we call them osteotomes, and then you get to the right length that you want, the right diameter, and then you basically use a ratchet and you screw the implant in. Leave it set in there about 3.5 to 4 months where the bone actually grows into the implant. It does what they call osteointegrates, and after that, then you take an impression, you're ready to put a crown on top of it. Very, very good. There's not very many drawbacks to implants. They're very nice other than the cost.
So basically it's like a root canal, but it's screwed in instead of...
It's easier than a root canal.
It's easier?
It's more predictable than a root canal too. Root canals are about 90% successful to save a tooth. An implant is about 94 to 95% successful. So very good treatment. So
What's the cost for those that implants?
what's the what?
The cost.
The cost of an implant? There's so many different ways to quote a cost of an implant. If everything goes normal or goes right, so to speak, and it's the easy case, if you would, an implant cost is going to be between $1,500 to $2,000 just for the implant, and then you have to put the crown on top of that, which is generally going to be another $900 to $1,200 on top of that. So one implant, if you say how much does an implant cost, well, by the time you put the crown and everything on there, it's going to be $3,000 to $3,500 to put it on there. There's ways to getting them cheaper.
You mean for each implant?
Each, yes. There's ways of getting it cheaper, but by doing so, you run the risk of liability and stuff like that. If you use products that are not from the United States, you can get them for a lot cheaper, but that's not good if you ever have a case that fails. Yes?
I know it's being late, it's 8 o'clock, but I had a question you maybe can answer after. On the bacterial pneumonia page, there's, in the middle it said something about aspiration of the pharyngeal. I was just wondering what that is, what does that mean?
It's just basically bacteria that's found in the mouth. If you aspirate it or you swallow it, it gets down into the lungs, and then that's, or even from the nasal area, that's going to go down and cause pneumonia.
Okay.
Yep.
Right.
I have a quick question that I've just kind of wondered, it just kind of makes my mind go all, I hear people go across the border and get dental work next, I'm just so afraid, I just would never do it. But have you ever had a patient that had gone across the border and you've seen the work? What does it look like?
You can get good work done south of the border. When I went to a place called Algodones, which is down by Yuma, Arizona, we actually knew a person down there that does dentistry down there. And if you go and find the right people to do it, you will find good quality work. The problem is finding the right people to do the work. I get cases that come to see me and they're having a problem with a bridge that's 8 or 9 units, which is 8 or 9 teeth on a bridge, and they say, well, this thing just failed already. I've only had it in for 6 months. You know, then they say, I know where it's made. I can tell by looking at it that it's made south of the border, and then they want me to fix it. And I say, you know, you really need to go see the person that put it in to be able to fix it. You can get good quality work done down south, but you have to look for it. You have to find out where they're trained and so forth too. There's a lot of good dentists down there, but there's a lot of not so good ones.
I've thought of things like an implant for people that have dentures to help them keep them in place. How does that work? Would that work?
You do the same thing. Can you type in Tim Conway?
Tim Conway?
Yeah, and type it in and it should show up. Basically what you're doing is you're putting an implant just like you would the other way, like I already explained. Instead of putting a crown on it, you're attaching it to a denture is what you're doing. So usually you'll put 2 or 4 of them in there and you'll snap them into place.
And then they wear the denture all the time?
Yeah.
Is it cheaper?
Which one?
It's probably the top one. Is it cheaper? It's
Would they
you have to make
them out for cleaning and things?
Yes, you can. You have to basically make a whole denture first for it. So.
And you said how much? Is it cheaper?
No.
Yes and no. You're asking me tough questions. And the reason why I say that is if it's something where you have a denture that you can take in and out of the mouth, then it becomes cheaper. If it's something that's fixed, what we call screwed in place, that's not cheaper. So anyway.
Maybe we can take one more question, and then afterwards, will you be available to answer
Yeah,
your question?
and I have a little video
Sure.
too if you guys want to watch a
Sure,
video.
and
It's
afterwards,
kind of cute
the question,
too.
you can see that.
Sure.
Okay. Are there any reasons why a tooth would reject a filling?
A tooth reject a filling? I've never really seen case. It depends on kind of, I guess, what your term, how you would define reject.
Well, if somebody has got a filling and it fell out, okay, is there a reason, other than workmanship, is there a reason why maybe a tooth may not hold a filling for some
Not
reason?
usually. I mean, the number one cause of failure of teeth, of fillings, would be recurrent decay, getting decay around existing fillings. So there's not really a rejection cause, but some people may correlate rejection with, okay, my tooth is killing me now that I got a filling done. Well, what's happened is the nerve has become really, really irritated with what's happened and causing a lot of pain and so forth. So.
I've been to Algodones, so which
Which one? I'd have to see if I can get his name.
On the left side?
Yeah, the right side or the left side. I'd have to ask my dad what his name was. I don't remember.